I'm about to tell you something that the medical system doesn't want you to know. In fact, society doesn't want you to know this. But did you know you can actually birth your baby on your own? Now, I'm not going to say that this is true for you if you have complications, and I'm certainly not going to advise you to birth your baby on your own. And at the same time, the reality is that yes, you could birth your baby on your own. The reason why many people say not to is because of fear. Fear of something going wrong is one of the biggest reasons why people tell you that you should not birth your baby on your own. It's why a lot of moms go to the hospital too early in labor because they're afraid of birthing in the car. It's why a lot of people say no to home birth, or they worry that because the midwife says, I'm not able to attend your birth, that they automatically have to go to the hospital. And this leads to way more C-sections than is actually necessary, because when you feel like you can't birth your baby on your own, you're more likely to listen to the outside voices that tell you you have no choice but to agree to that C-section. Hi, my name is Carly Bonderud, and this is the Empowered Birth series where I go deep into everything that you need to know to plan and get your empowered true natural birth. And in today's video, I'm going to touch on a very, very controversial subject, which is free birth. Now, a lot of people look at this, and I don't blame you, as a very reckless choice because of the fact that we have this perpetual idea in our culture that you can't birth on your own. We have a dichotomy, and this dichotomy is what I aim to bridge the gap on with the empowered birth method, because I believe you are your own best expert. And I also believe that natural birth is the default setting. Your body is going to do it, whether anybody approves of it or not. If at any point you realize you need help, you deserve to get that help. And the women that I've helped to have natural births have had extreme pressure put on them to have repeat C-sections. It's not okay. And that is why I've created the Cesarean Trap series. So if you are brand new to me and you don't know my philosophy and you don't know what this is about yet, I'd like to let you know, first off, hold off on commenting until you've watched the whole video. Or at the very least, ask the AI what this video is about and summarize. Ask any questions you want. Ask whether I support hospital birth. Ask whether or not I'm scamming moms. Ask anything you want of Google AI. It will tell you. I believe that birth can and should be a beautiful and empowering experience, and it deserves to be your choice whether you have a C-section. It should not be something you're forced into based on lack of options. So the empowered birth method, which I created for my own natural births, is something that I believe will bridge the gap. And it's something that a lot of my clients have also used to bridge the gap. I also believe that information needs to be free, and I only charge for access to me. That means you can binge watch any one of my master classes. You can binge watch any of my videos, and you can piece things together yourself. You can even ask questions inside of the comments, and you can share resources, and I can also verify where things are missing pieces and tell you, hey, there's something in my resource library that will add to that. I believe, again, information needs to be free, because when it's behind a paywall, you get, well, what we have right now, this dichotomy. So this video is going to be a little bit different than all of the other cesarean traps that I've already listed within the 21 cesarean traps. And that is because this video is what I would call the most important. It ties everything together. So I've talked a lot about VBAC after multiple cesareans, and I've talked about VBAC, and I've also talked about how to avoid the primary C-section in the first place. But what I really want you to understand is that all of these have a common theme. A lot of the time, moms are told you can have a natural birth as long as, and then a list of arbitrary guidelines come into place. And a lot of those are natural birth traps. Go check out my natural birth traps series in the playlist if you want to learn more about that. I would also suggest you check out the Reset Your Mindset for Empowered Birth mini challenge, because that is going to help you see how we got into this mess in the first place, as well as what the fear traps are and how to get out of them. Finally, I'm also going to mention I do have a paid program called Your Empowered Birth Academy. Now, I have gone back to roots within my business, and sometimes I have my big fancy website, and other times I don't. You see, as part of Empowered Mom Magic, which is the other side of my business and branding, I believe that we deserve to be able to call in our abundance and build our business without having all of the fancy tools that cost a lot of overhead. So from time to time, I take down my fancy website and I just go back to roots. If you go into the link in my bio at the top of the screen and tells you what my link tree is, if you go and check that out, you will get my most up-to-date resources. I highly suggest that before you ask a question, you go to the link tree and ask the tree. You may have your wish already granted and you didn't realize it. But with Your Empowered Birth Academy, which is a paid program, you can ask the question of, what does Carly Bonderud's Your Empowered Birth Academy actually contain? I can also tell you right now. First of all, I help you learn about natural birth and how to plan your true natural birth experience, including if you wanted to do it completely hands-off. Whether that's in the hospital or at home, you can have a hands-off birth. Second, what I do is I help you get past fears. This is really important because if you are still afraid, you're going to believe the stories that the medical system tells you when they start trying to push a C-section. You also get to recognize that the medical system themselves, those staff members, the nurses, the doctors, the anesthesiologists, the midwives, they're afraid of something. They may be afraid of something going wrong. They may be afraid that they don't know how to support the kind of birth that you want. They may be afraid of litigation. They may be afraid that they'll get in trouble. They may be afraid of being the ringleader. And they may also be afraid of Category 5 care providers. These are the people that know how to step on necks to get to the top, who can make life very difficult for somebody who doesn't toe the line. Now, the reason why I'm telling you that you can do this yourself is because this will deactivate the power of the Category 5. It will basically dismantle the old system of hierarchy where you are at the mercy of the system. The next step in the empowered birth method that I'm going to let you know about is the idea of getting your partner past their fear, because your partner is the wild card and your partner needs to be able to protect the space. If your partner is not protecting your space, they are actually hindering your progress. And they may start to say, maybe we should get the epidural. Maybe we should agree to that IV. After all, something bad could happen if you don't. Maybe you should just have that C-section. And so on and so forth. Now, you don't want to fall into the cesarean traps, and you also don't want your partner to be reinforcing those traps. So with the empowered birth method, you really do need to train your partner up to be the birth protector, and you are the birth visionary. So to learn more about that, make sure you check out some of my other videos on partner support, because I believe you need to have the right support. There's also some journal prompts within Your Empowered Birth, that little blue book behind me, that helps you to get your partner on board. And then the last piece of the empowered birth method and what's in Your Empowered Birth Academy is becoming the birth consumer. Recognizing that your care provider is someone you are hiring for a service. Therefore, they need to be providing the things you ordered, not what's on their menu. If you walked into a restaurant and you wanted something off the menu that was a little bit customized, and they're still pushing their special on you and saying, yeah, no, I know you want to have that, but Instead, why don't you just get the special? The special's really good. You'll be fine with the special. Not everybody complains about the special. I don't understand why you keep insisting on having this other thing that's not the special. Well, you deserve your own special. And that means that you aim for a true natural birth and pull back only as much as needed. So essentially, what you need to know is this: you can birth on your own. And I'm going to give you some books that are going to help you with that dream. Because as long as you know that you can birth on your own, then what's going to happen is that you'll stay home longer. And you won't be afraid about possibly having your baby at home unassisted and having the midwife or the paramedics come at the last possible minute. You're also not going to be worrying about having a baby in the car. That won't be scary for you. You won't be afraid of having the baby in the lobby at the hospital. You won't be afraid of having the baby with the doctor not able to attend. And you won't be afraid to say no to the nurse telling you that you need to just agree to this vaginal exam that you don't need, and you know that you don't need it. In fact, this is what Jenny did. Jenny knew that she wanted to have a hospital birth. Jenny was right to want to have a hospital birth. She had chronic high blood pressure. She had gestational diabetes. She had a history of preeclampsia with her first baby. Of course, she'd want to be able to monitor that. But at the same time, Jenny waited until the last possible minute to finally go into the hospital. Jenny utilized the empowered birth method, and she was able to say, no, we're not going to the hospital until I absolutely need to go. Jenny's waters had even released early in her labor, and she still did not go to the hospital until she felt that she needed to. Jenny arrived at the hospital 1 hour before she pushed her baby out. She was already sort of pushing in the car. She wasn't afraid of giving birth in the car, and she wasn't afraid of telling the nurse, no, you're not touching me. No, we're not doing this blood draw. No, we're not doing this vaginal exam. And just because you can't seem to find the heartbeat of this baby that I'm actively pushing out does not mean that I need any intervention. Just call the doctor. And, the thing is that Jenny ended up birthing her baby unassisted in the hospital because the nurse was a little bit stubborn and skeptical and refused to call the doctor until she got an assessment. She was more attached to her checklist. Now, this isn't to say that the nurse was wrong and bad, because, that's how they're trained. My dad is actually a psychiatric nurse, and he has told me they really do need to have that checklist. And I'm like, well, what if you just say the patient declined? And he's like, well, they could do that. But, sometimes people get so attached to the checklists and they're afraid of something going wrong that they'll push the issue. So the empowered birth method is a little bit of birth education and a lot more psychology. And so what you really need to understand is that if you want to have a natural birth, as natural as possible, you need to be willing to be able to do it yourself. Even if that's not your actual plan, you need to have that as one of your backup plans. I'll tell you another story. I wanted to have a home birth, and the first time I was told I wasn't allowed, I believed them. I believed that I wasn't actually going to get any support if I needed it. That can be really scary. And I almost got a C-section because of the fact that my baby wasn't being pushed out within the 1 hour time limit. I was pushing for 3 hours. But, because I knew that I could do it and I was prepared to do it without anybody telling me I was allowed, I was able to have that natural birth. And the second time that I was told that I may need to transfer to the hospital, that's when I decided to send the midwife away and call her only when I was pushing. So you need to recognize that if you want to have a natural birth in our current birth culture, and that is what it is right now, you need to be able to do this yourself. You need to be able to get past fear. And there's a few books that I highly suggest that you check out. And these are the ones that I also give to my clients. And either I have them buy it if they want to buy it themselves, or I buy it for them, and it comes through Amazon Kindle. Number one, my absolute favorite is Reclaiming Childbirth as a Rite of Passage by Rachel Reed. This goes into the deep dive education on physiological birth. It helps you understand the rights of protection as they were before we got pushed into medical birth. So you can understand that, yes, we did have women that supported us during our births, even back then. Yes, there were times when people did die, but it's not as dire as what our birth culture would have you to believe. In fact, a lot of the time, when you look at those stories, you realize, well, wait a minute, that person was like 12 years old. And that pregnancy was also not planned and not wanted. And let's also look at the fact that there was no sanitation back then. Obviously, there were a lot of women and young girls even that were having pregnancy complications when the patriarchy took over. Again, reclaiming childbirth as a rite of passage is incredibly eye-opening. And as you can see, I also have a whole bunch of Post-it notes to show where I'm marking the pages for different things that you really need to understand. I'm not going to go into everything, but what I am going to tell you is that in this modern age where we have access to medicine and we have access to surgery if needed, do we really need to just go that route, or can we balance things out with natural birth? Another excellent book in my collection that I also give to my clients is Home Birth on Your Own Terms, because this is basically a free birth guide written by a midwife who had complications in some of her pregnancies and still birthed her babies at home. So what I suggest is that you get both Reclaiming Childbirth as a Rite of Passage and Home Birth on Your Own Terms, because those two books, in addition to the information that you get through the Empowered Birth Method, is exactly how I help my clients with their natural births. Finally, if you want to be a little bit ambitious and have a pain-free orgasmic birth, then check out Orgasmic Birth by Deborah Pascali-Bonero and Elizabeth Davis, because that one is going to tell you the steps to take to get a less painful, possibly even orgasmic birth experience. I mean, sometimes we're a little ambitious, sometimes we're type A and we want to plan everything. And I myself am a type A. So recognizing that there are so many resources out there for you. There's a lot more books that I could get into, but I'm not going to. There is a masterclass that I did where I covered 15 books, and you can check that out in the Essential Tips series playlist on my YouTube channel. Okay, so we are now coming to the end, and I'm just going to quickly recap for you. Why do you want to make sure that you can birth on your own? Because that way, when the medical system starts putting pressure on you, you now have the option to opt out completely. You can say to them, or even just think it in your head, yeah, that's cute, and I'm not buying it. Because when you can't be tricked, when you can't be trapped, when you can't fall into the fear traps that they keep trying to lead you into, that's when you keep your power. As long as you stay out of fear and don't let other people project their fears onto you, and you don't take them on, as long as you do that, you remain in your power. But you've been taught through social conditioning that you have to be the good girl. And I'm going to invite you to let go of the good girl label. Become the birth consumer instead. After all, the customer is always right. So that's pretty much all I have for you. Thank you so much for watching. Next, I'm going to tell you all about the ways to apply the Empowered Birth Method. So you're going to want to check out that video, especially if you want to go deeper with this, because the deeper you go with me, the more treasures you'll uncover. I'm also going to give you additional tips and more resources to check out to avoid a C-section or to plan a VBAC. So that video is coming up next. And then after that, we're going to start a new series. So thank you so much for watching. Have a happy, empowered birth journey. Whether you're birthing a baby, a business, a creative project, a movement, an impact, or a new version of yourself, let Empowering Moms be your guide. So thank you so much, and I will see you next week. Namaste.